The heart itself has to be fed by conduits, by arteries. And if these arteries, the so-called coronary arteries, become blocked, then bypass surgery may be necessary. My name is Dr. Johannes Bonadi. I'm the chief of the Heart and Vascular Institute at Cleveland Clinic Abu Dhabi. In robotic bypass surgery, we enter the chest through small, tiny holes on the side wall of the chest. The main benefit of robotic surgery is that the surgical trauma is significantly reduced. This leads to faster wound healing and earlier recovery of the patient. Robotic surgery is probably the least invasive way to do bypass surgery. Basically, the surgical instruments are mounted on robotic arms. And these robotic arms are controlled by a surgeon who sits behind a console in the same room. The surgeon looks into a 3D binocular and looks into the chest through the scope that is attached to the patient. The view that you have as a surgeon sitting behind this console is magnificent. It's a fantastic 3D HD view of the anterior of the chest, up to 10 times magnification. All this enhances the precision of surgery. One aspect is also that the robotic arms filter all tremor that the surgeon may have. Once the patient is in the operating room, anesthesia puts the patient to sleep. Robot is docked to the patient. We use 4 entrance ports on the side wall of the chest. These tubes are then connected to the robotic arms, and we insert the instruments and the robotic camera into these ports. And then we take down the bypasses. These are connected to the coronary arteries, downstream the blockages. We can suture remotely behind the console. So all the movements that we do on the masters are translated into movements of the robotic instruments. Once the bypasses are sewn in, we let the heart rest on the heart-lung machine for a few minutes. We measure the flow in the bypasses to check there is adequate flow going to the heart muscle. And then we, as we call it, wean the heart-lung machine and disconnect it. Once we have an overview that the bleeding has stopped, we undock the robotic system and then we close the portholes. The patient, after robotic bypass surgery, goes to the intensive care unit, stays there for 1 or 2 days. The patient needs to sit out in a chair the next morning, usually, and walks a few steps, can eat and drink the next day. Recovery process in the 3 to 4 weeks range can be expected until the patient is back to all normal activities. The heart is the motor or the engine of the body, which pumps blood full of oxygen into all parts of the body. We have come to a stage where we can do these extremely advanced procedures, performing a complex heart operation through tiny holes on the side of the chest. And seeing the patients recover within 3 to 4 weeks is amazing.